Hi, folks. Welcome to Smart Living. Well, I am so excited because I have Gina Katz, who is an insurance broker for health insurance, joining us today on ways that you can save money when it comes to health insurance. So, Gina, welcome to the show.
Thank you, Debbie. I'm so excited to be here.
Now, first of all, I know you as an insurance broker because I've need your services, but what is the name of your company?
It's just Gina Katz Insurance. So,
Okay, I love that.
Yes.
Now, for people who aren't familiar with insurance brokers, can you explain what an insurance broker actually does and why we would need one?
Perfect. And great question. So I look at brokers as doing the heavy lifting for the consumer. So when you're looking for health insurance, you don't know exactly what's available. So I find out the needs of my particular client, and then I find the plans that fit the needs of those, the use of how they use it for whatever purposes and health conditions and so on. So,
Is it common for the average consumer to be using insurance brokers? I mean, like, why would somebody need one? Like, is it because, like, you're self-employed probably? You need insurance if you're not through an employer?
That's also a great question. Most people don't even realize that it's a free option, and you can look for a broker. And they really, like I mentioned, they take the heavy lifting out of insurance and what's available. And quite honestly, most consumers don't understand that they can actually get insurance all throughout the year, not just an open enrollment.
Right.
So there's education that goes along with that, which is my favorite thing, is really helping my clients guide them on what's available.
So you have many different insurance plans for many different insurance companies that you work with.
Right. So I represent about 30 plus plans.
So that is a great benefit, being an insurance broker. So say, for example, like myself, I'm self-employed. I'm finding out that healthcare.gov isn't necessarily fitting the needs for my particular needs. So that's why I reached out to you, as an insurance broker, and you have a variety of insurance plans that meet every different kind of needs.
Exactly. And sometimes if I can't find the perfect plan, because everybody has their own, they may have conditions that maybe I can't help with. I have colleagues that I will pass them on to so that they can find the best care.
So you're more than just an insurance broker who's actually trying to find people health care. You're actually somebody who's a consultant also.
Exactly.
And help people weave through that. Because I'm telling you, this health insurance thing, it is incredibly stressful. Mm-hmm. And as I had mentioned earlier before we started recording, I remember before 2008, my ex-husband now, but at the time was my husband, he had pre-existing conditions. And before we had that healthcare.gov, I mean, it was like you could only shop private insurance if you were self-employed. I mean, there was no other options to go to. So I'm glad that we still have insurance brokers like you who still carry many plans, because I wondered if that had changed after the healthcare.gov.
Yeah, no, not really. And in fact, I think that's a mystery to a lot of people that they don't realize that you still can get private insurance, whether you're self-employed. I have clients that reach out to me that maybe their spouses have a group plan that's gone up and they're looking now for other options. So I can help self-employed, people that already have group plans, people that maybe don't fit the need. They're on an Affordable Care Act plan and they maybe, need more care, or they have, it's more expensive for them. So I can help all walks of the earth, I guess.
Well, yeah, I mean, you're really a gem. I mean, like, you're really fitting a need that a lot of people have in this country, period, in terms of needing the health insurance and being able to navigate it. So can I talk to you about, like, specific plans, and can you give me an example of how people might be able to save money by going through you on their health plan?
So, okay, perfect. So I think when you talked about me being a consultant and getting insurance, I kind of compare it to taxes. Nobody loves doing their taxes.
Yeah.
Nobody wants to look at insurance options because it's very confusing. It is very confusing.
And stressful.
It is very. And so they'll come to me, they usually get referred, and I look at their overall picture and then help them with what that looks like. So, for example, a lot of my clients are typically healthy, and they don't realize they can get a more affordable plan because they're so used to either a group plan or maybe an Affordable Care Act plan. So there are a lot of plans that I represent that either have very low deductibles or no deductibles at all. And those are for people that are fairly healthy. And when I say fairly healthy, that's going to be no cancer, strokes, heart issues, things like that, like very serious diagnostic issues. So when we have an expensive group plan or an Affordable Care Act plan, we're paying for all the risk for everybody else. That's why rates keep going up for
Right.
people, deductibles go up. Usually the level of coverage goes down. So a lot of my plans for the healthy consumers, and I can help people with type 2 diabetes, people that had cancer 5 years out. They're just more affordable and flexible. And they're major PPO plans,
Okay.
but they're really geared for the average consumer, right?
Right.
How the average consumer uses insurance. And I've seen a huge trend in people looking for coverage for naturopath doctors, functioning medicine, maybe hormone doctors, those type of things.
Yes.
We're getting to that age where, hormones, and that's not usually covered. And so these plans
not.
give you a benefit for that. And a lot of people like to do blood work, and they don't want to go to the doctor for that. And they want to be able to do that. And these plans give you that flexibility of actually doing that on your own.
Okay.
So I do have a number of plans that are like that, and based on what the client comes to me with, I weed out the ones that maybe don't exactly fit their needs.
Okay.
So I can work with different budgets. I can work with different health issues and things like that.
So what I hear you saying, and from previous conversations, is that a great reason, and your plans are great, and they can be very affordable, because really with private plans and not the Affordable Care Act, pre-existing, they can discriminate between that, because these are private insurance plans versus the Affordable Care Act, where they cannot discriminate in terms of whether you have pre-existing conditions or not. Am I correct on
Correct.
that? Okay.
Yes.
So because of that, that's how you can get us a savings, because your clientele basically are people who are average, nothing major health, no cancer, no heart issues, no strokes, no things like that. Just average, things as we go on with time.
Mm-hmm.
So that's where the savings is. Is that what I kind of hear there?
Exactly.
Okay.
Exactly. And that's, a lot of people don't know that.
Yeah.
They don't know that that's available. And I do have plans as well that are for people that have chronic illness, or maybe you're in the middle of cancer. I have plans for that too.
Mm-hmm.
And they're much more affordable.
Okay.
Kind of I always give people little hints on things or tips. The Affordable Care Act plan is great for people that do have chronic illness. And if you're in that window of time for open enrollment, which is right now,
Right.
Through January, you can get on those plans. But if you're outside of that, you're going to probably want to talk to a broker that has those plans, which
Okay.
I have plans you can get all throughout the year. Affordable Care Act plans only cover you in your state. Some people don't understand that. So they're a little bit more restrictive, where my plans that would cover somebody who has a cancer, like in the middle of cancer, or just had a heart attack, I still can cover them. They're still more affordable, but you can go to any, hospital outside of, Arizona. You can go anywhere. So it doesn't limit your options for
Okay.
care.
Now, this is going to be a subjective question. I don't know if you're going to be able to answer this, Gina, and thank you for clarifying that. But with your plans, I'm all about the dollar signs. So how much is it going to cost me? Can you give me like an example of like what some plans will cost? I know it depends on, because there's age, there's sex, there's all of these things, but let's just throw something out there. So for me, let's just say like I'm 53 years old. I'm relatively healthy. I haven't had, fortunately, any major health issues, which I will, because we're all going to die someday. That's a fact. But, like as a, single woman, like what would something like that cost? Can you give me a range?
I can.
Okay.
So again, it's based on your zip code, and it's based on your health, and it's based on your age. All those three things are key factors. But for you, because I kind of looked at a quote,
Right.
in case you asked me, no. So you could have a plan as low as $220 a month.
Okay.
And that particular plan that I'm talking about for $220 a month doesn't have a deductible unless you're hospitalized overnight.
Okay.
So unlike like a employee-sponsored plan or
It's always
Affordable Care
deductible.
Act plan, you're going to be paying a deductible up until that amount before real care starts.
Right.
You'll get your preventative care, but you won't get, if you injured yourself or you were sick, you're not going to get coverage until you meet that deductible. You have to go get an MRI. You're going to have to meet that deductible. So these are much more flexible and affordable plans. So that gives you kind of a range.
Right. And this is so like subjective. So if you guys are listening out there, remember the requirements that I gave her. So we know it could be much more expensive, depending on what your issues are. It could be a lot less. I mean, if you're probably in your 20s, that plan would probably be a lot less, depending on the situation. So I do appreciate you at least trying to challenge that. But that seems, at least within the range of reasonableness, for that. So I like that. I love to hear those things. Now, when it comes to health insurance and plans, now I know that there are insurance plans that people go for with high deductibles, right? And, what are some things, let me back up here. What are some things that consumers should look for when it comes to shopping for health plans that are key things to pay attention to? So let me give you an example of what I'm trying to say. Okay. So for example, when at Southwest Airlines, which a flight attendant, which is what I am employed as. And we have this remarkable health insurance plan where there is no preventative care is covered. That's so unusual on a plan. But I always try to explain to people, I'm like, no, but that's actually what you really want, right? So this is kind of what I'm trying to say. I'm not asking the question very well, but are you understanding what I'm saying?
Somewhat. Are you? Okay. So what I'm hearing you say is that what should consumers look for when they're shopping for a plan? So you talked about high deductible. So some of the things that surprise my clients when they get connected to me is the plans that I offer. A concierge, I guess you could say I am. I help people not only find a plan, but help utilize that plan to its fullest. So one of the key things is people don't realize that if they have an insurance plan, that they can self-pay for care. Even if you had an Affordable Care Act plan, you can self-pay for care. Why would a person do that, right? Why would a person have a plan like an Affordable Care Act plan and self-pay? Because if you, for instance, went and got an MRI, I just had this happen with a client, they had to meet their deductible. So they had to pay $600 for an MRI. This client asked what self-pay price was. It was $400.
Yeah, so it made sense.
So they paid that. So I teach my clients that. So, and you have the right to do that. Right. It's a HIPAA law. But you can self-pay.
But if you self-pay, was that $400 applied to the deductible then? No. Yeah. No. So that's where you lose out on that a little bit.
Yes. But in most cases, like this particular client had a $7,500 deductible. There's no way, she said she's had it 3 years, this plan, that no way she's ever met that. So again, it's just a better way of managing dollars. And we don't do that with health insurance. Yeah. We do that when we go shop for a car or buy a couch
prices on everything.
Like that.
Yeah.
But we do not do that. And so people are always very shocked that you can do that. And so a lot of my plans really encourage people to self-pay in some cases because they get a better deal.
Yeah.
And then, for them, it's also very eye-opening because they've had group plans in the past and they've always felt like they paid out for their
right.
I'm paying a premium, I'm paying this deductible, and I don't feel like I'm getting any benefit. Did that answer the question?
It absolutely did.
Yeah. So there's flexibility in insurance, and that's where it gets fun for me. I get very excited about it because I tell people I feel like that's my super strength, my superhero strength is helping people navigate cost of care, which is unfortunately very non-transparent.
No, it's not, and it's really unfortunate. It's really unfair, but we won't get into it because I'm going to start talking about politics here. but it is unfair because we're all going to get sick at some point in our lives, and some people have spent their entire lives being sick and fighting an illness or something that a heart disease or something they were born with at a young age and have a lifetime dealing with health issues. Health issues can come later on in life, that's what we hope. But at the end of the day, we're all going to die, and one of the ways to die is you gotta get sick. So hello. So I just wish we can come up with a solution so we could plan for that for everybody, right? And everybody could have that care because without health care, you don't have it. But I get that, one of the having many conversations with you, you really literally are like a counselor. Like you are. You have to because you have to teach us how to navigate. And just even the few conversations I've had with you, I've picked up a couple things. And also when you're sick in the system, you learn how to be your own advocate in healthcare. Absolutely. So I've learned, I have a daughter who has an illness. And so, and my ex-husband too had an illness. So the two of them, I've taught them how to navigate the healthcare system. And that's why I know the one thing that people aren't aware of is when you go to the doctor or get a service, there's actually a cash price. You just have to ask them.
Exactly.
And you can choose whether to use your health insurance or not. Just because you have health insurance, they're like, give me your health insurance card. And you'd be like, no, you know what? I'm going to go ahead and ask you what the cash price is. That's something consumers need to be empowered about and be aware of.
Exactly. 100%. And that's what I teach and help and support them with because some people don't want to ask, right?
Yeah.
They don't want to ask.
Yeah,
They
it's scary
feel-
for people.
Yeah.
Yeah, I always say the worst someone could say is no.
Yes.
Like,
Yes.
it's a big deal. Or, oh, okay, someone's offended by your question. Big deal. But you're allowed to ask a question
Yes.
and then get a proper answer. So I think that's really important. I appreciate you pointing that out. Now, the other thing, we didn't talk about like pharmaceuticals. That's also part of a health plan insurance. And if you're relegated to having to take a medication to stay alive, this can also be very detrimental. This can be, I mean, especially when you start to get older, you have diabetic medications, you have heart medications. And I mean, some of these like retired people are going bankrupt because of the medications that they have to stay alive. That's not fair.
It isn't. It isn't. And again, I have many resources for things like that, prescriptions. It's kind of a crazy thing. A lot of times I share with my clients GoodRx. We all see the commercials for that.
I know GoodRx.
Free app. You can get it on your phone, and it'll discount drastically on medications. So that's one tip that I will give my clients if they don't know about that. Because oftentimes people have group plans and they're paying much more for their copay for their prescription
Than what
than
it's
if they
actually
were
cost.
to buy it with GoodRx.
Right.
And so same with Medicare clients. I work with Medicare too. We have a great Medicare clientele, and I help people that maybe have a very high, it's usually heart related or diabetic medications. I help them navigate that as well. And I have a resource, it's a nonprofit, and I have a resource that my clients can utilize for low cost medications. So if you're not using like a GoodRx or one of Mark Cuban has a
Oh, yes. Love him. Love
think
him.
of it off the
I know,
top
there
of
can
my
I.
head.
Neither
Oh
can
my
I,
gosh.
but yes, he does. It's phenomenal what he's doing.
But that's like the basic generic. GoodRx has a little bit more variety for it. And then there's a bunch of like non or low cost solutions.
Well, even the manufacturer of the actual medication often have huge discounts. Like, especially if it's a new medication, you can qualify for that.
Yes.
So I know my daughter, she was on Rinvoq.
Yes,
And that
that's
was such a
expensive.
new, incredibly expensive. So she's gotten a discount. I mean, we really had to educate ourselves on how to get the most discount because that was the only medication that solved her problem.
Yes.
So it's the same situation.
Yeah. And I even if somebody comes to me, a lot of times people will refer me to somebody and they may have a plan, but the medication is an issue. And I'm happy to help people, even with just, if it's just medication, just giving them a option or a resource to help them with that, because there are ways to save money in that area.
Oh, big time. Well, it's so funny that you mentioned GoodRx because back in the day when I used to be that smart shopper on ABC 15, I did a story on GoodRx. Yeah, when they were first coming out. As a matter of fact, I talked to the CEO of the company at the time because they were so small. Yeah. And it was great. I love to see that they have expanded so much because it was such a wonderful resource for people to have. And now pharmacists always mention, they're like, oh yeah, download the GoodRx, you get really good discounts. And plus Mark Cuban. So that is fantastic. And also recently we had legislation for a lot of, the most common medications that like elderly people take that have been discounted.
Yes, like they passed that with Medicare. So
Right.
now, which is, their drug plans are much more affordable, which is great.
Right. And by the way, that was the Biden administration that passed that. Sorry, can't help. People need to get credit that's given to them. But yeah, and that was huge. That was instrumental for people. So I was very happy to hear that they did that because I'm sliding into that age group here. I'm not that far away from that.
You're
so.
But as time flies fast, and
Right.
next thing we'll know, we'll be there. But
Well, yeah, I mean, I may have a few years, but I'm not as far as I was when I was in my 20s. So, but anyways, Gina, I really appreciate you coming out and letting people know. Now, how can people get a hold of you? Although I'll have the information on my website, but how can people get a hold of you? Is it best to just email you or should they give you a call?
Either way, so do you want me to?
No. We'll get that later, but I just want to know if
phone
it's
number,
email.
One last thing is when people, an expense that people have a hard time with is diagnostic or ER visits.
Okay.
And I have some great resources if you would like me to share that you want to pass on.
Go ahead. I'm like getting ready to cut you off. I'm so sorry.
Emergency rooms are like they're the profit centers of the hospital, and they can be very costly to go into an emergency room for the most common things. So I have a great local resource that you can go to an ER 24 hours a day, 7 days a week, get in quickly, great doctors, and it's like $600 for like a mid-range. They do levels of care. So if you have a more chronic issue, then it's more expensive, but $600 on average, where if you went into an emergency room, you could be $10,000, $15,000.
Oh, yeah.
Yes.
Now, when you said local resource, you mean like this is a local place that you can go to?
Yeah.
Really? How'd you find this out?
So a client told me. A client told
Really?
me about it, yes. Because I help, again, my clients
Right.
with ERs, and they said, oh my gosh, I found this great resource, and I went in. You can also get labs at a discount, walk-in labs, walk-in diagnostic. You get an MRI, same-day CT scans, because those are areas that are very, very costly for people. So I'd like to pass it on to you to share with the listeners.
Yeah,
because
go
it's a
ahead.
Great,
Can you tell me what the name of it is? The place?
So one is Phoenix ER.
Okay.
And then there's 4 locations. I can't remember if it's one like Mesa ER, but I know one is Phoenix ER. And a lot of them are in the East Valley, but they're owned by doctors.
Okay.
So unlike hospitals, that's who gets paid, or
Right.
not the doctors and the nurses when they get those big bills. But so it's a group of doctors that own the practice, and very clean, easy to get into, and they understand the issue at hand, and they have accommodated that for the consumer.
That's fantastic. Okay. Before I wrap this up, is there anything else that we should know that I might be missing?
No, but anybody's welcome to call me, because
Okay.
there's no pressure. I didn't get into this doing this. I didn't wake up one day and say, I want to be an
I
insurance
know, you
agent.
totally just kind of fell into this.
I just, my whole thing is helping people. I'm very passionate about how things are really out of control right now with cost of care. And there's little simple things that people don't know, and I would love to share. So if they're welcome to call me, reach out to me. I'm happy to help.
Okay, that's fantastic. Well, Gina, I look forward to seeing you next time on Smart Living. I appreciate you taking the time to come out and share some valuable information. And also the Phoenix ERs, email that to me. I'll post that on my website, which is smartshopperdaphne.com, where you can also listen to this podcast or view it. And don't forget, guys, I'm Daphne Monroe, your smart shopper.